Well, good morning. We're back here at 10 minutes past the hour. According to a survey by the Cleveland Clinic, most men, more than 70%, would rather do household chores, things like mowing the lawn or cleaning the bathroom, than go see a doctor.
I'm surprised that percentage isn't higher, to be honest with you. Since June is Men's Health Month, we thought we would talk about some of these issues. We asked KSTP's medical expert, Dr. Arkell Georgiou, here to help explain the reasons why many men don't prioritize their health and some important screening tests that they're most likely to miss. Dr. Georgiou, thanks for joining us today.
Thank you.
Why do you think men are putting off their taking care of this kind of stuff?
Well, the studies actually show that there are several different reasons why men don't like to go to the doctor. But just to add to that statistic that you said earlier, they'd also rather go shopping with their spouse than go to the doctor.
Wow.
I mean, it is dramatic. But one of the reasons that, of the many reasons, there's fear, there's embarrassment as to why men don't like to go to the doctor. But also another one of them is that studies have shown that men who hold on to a male stereotype of that machismo believe that I can get over this. I don't need help to get over this. And so those are some of the reasons.
Don't studies also show that men don't live quite as long as women?
Oh, absolutely. Women have a longer life expectancy than men, and so you would think that men would be aware of that
they
and
would be more proactive.
And let me be clear that 82% of men care about their health. They want to live a long, healthy life for themselves, for the people that love them and that they love. But when it comes to executing on that, that's where they fall short. So only 55% of men have preventive care screenings. Over 65% of men delay going to the doctor. So they have symptoms, but it'll get better. So they really put a delay. And about 20% of men, when they do go to the doctor, they don't disclose everything. So they're not completely honest, and that has its own consequences that can be associated with it. So they want to be healthy, but they don't quite get there.
Talk a little bit more about that then. So like you're at the doctor, you got the guy to the hospital, or he's at the doctor, he's doing the thing, but he's not talking about everything that's going on with them. So that can be very problematic.
Right, so let me give you one example. Really common example for men is not wanting to bring up issues around sexual health.
Sure.
And so, for reasons that we talked about earlier, embarrassment, not wanting to discuss it with the physician, not thinking that it's significant. But, 71% of situations where men have a sexual health issue, it's related to cardiovascular disease or diabetes. So if you don't bring up this symptom, it could prevent the doctor from having that light bulb go off to say, well, let's do these additional set of tests.
It's kind of like a car, right? You take your car into the shop, and if you just say, I don't know what's wrong with it, or if you say it's making this noise, or it's acting like this, or this seems to be the gears switching, like you have to give the detail, right?
Well, absolutely.
When you're there, and not be afraid. You have to help the doctor diagnose a little bit what's wrong.
Absolutely. And we were talking about screening. We'll talk a little bit more about that in a moment. But there are certain screening tests that are only done if you disclose that there is a symptom that needs to be evaluated further. So let me give you an example. Men don't typically have a breast exam by their doctor. They don't have routine mammograms. Women do, men don't. Unless you say, I have felt this lump in my breast that doesn't feel quite right. A big one for men is not mentioning that they snore a lot. And if they don't mention that, then the doctor's not going to think about, well, maybe they have sleep apnea. So there are a whole host of screening procedures and diagnostic tests that there's no indication to do unless the patient, the man themselves says, I'm having this problem, as minor as it may seem.
So let's talk about some of these specific screenings that you think are important. And one is for screening for lung cancer.
Right. So, we talk a lot about screening tests and for cancer, and we think about colon and prostate, and those statistics aren't perfect, but they're pretty good for men getting them done. But the one that is dreadful is lung cancer screening. So not every man has to have lung cancer screening. Those who are current smokers or former smokers who are between the ages of 50 and 80. And I have to tell you, lung cancer is dreadfully, it's a death wish. And so getting lung cancer screening, which is a strong recommendation, is something that less than 10% of people overall and men have done. It is, even though it's strongly recommended, it's paid for by insurance, including Medicare, but it it hasn't gotten the attention as those other screening tests that we talked about.
But would your doctor recommend it? Because I've gone to the doctor lots of times and nobody's recommended it. So you need to go in there and advocate to have this test?
Well, first of all, Chris, I don't think that you're a smoker. Hopefully you aren't. But I don't think you're a smoker, and you're not in the right age group. So you would have to be between the ages of 50 and 80.
No, I'm definitely in the age group. So that's what I'm saying. Like, so you go in there, and should I go in there with this list and go, listen, I should be taking. This is something that is important to me.
Absolutely.
Okay.
Absolutely.
Because, and then insurance that is something that insurance will cover?
It is a recommendation that is endorsed by the federal group that endorses all of the different screening tests that are mandatorily paid for.
Okay. What's the screening like for it? Is it something that's, I mean, I know a lot of people don't want colonoscopy because it can be seen as
that's another thing too, right?
It takes longer to make the appointment and drive to the center than it does to have it done. So it's a CAT scan that's not done with contrast. And the reason that that's important is there's no IV, there's no needles. It takes 5 to 10 minutes, and it does have to be done every year if you meet the criteria.
Oh, gotcha.
But it's a really easy test, and if they find lung cancer early, it's so much more treatable than if they find it late.
That's true.
Are there other screening tests that men are missing out on for things like cancer, other ailments that you recommend?
So we talk a lot about cancer, but there are other screening tests, and one of them is for a condition that you've maybe never even heard of.
Yeah, I never heard of this before.
Yeah, it's called an aortic abdominal aneurysm. So AAA, let's just talk about for a second what that is. So the main artery coming off your heart that delivers blood flow is the aorta. It goes down into the abdominal cavity to give all your organs their blood flow. And an abdominal aortic aneurysm is when it balloons out. And if it balloons out and the wall of the artery gets too thin, it's at risk for rupturing, right? So again, men who are in a certain age group who have been smokers, again, smoking is a risk factor, should be screened just once to see if they have an abdominal aortic aneurysm, and also be screened if you have a family history of an aortic aneurysm.
Can I ask what happens if you have one of those aneurysms?
So, yeah, it's like a balloon. So if it gets too big, it could rupture.
So it's not like a heart attack because it's geographically below your heart.
Right, so it's not a heart attack, but think about if there's all of your blood flow from your heart is going into the aorta, and that ruptures, that's a fatal event.
Is there a fix for it if doctors catch it early?
So what they do, the reason that they screen for it is that they look at the size. And if it's getting to about 5 centimeters or greater, then the risk of it rupturing is high. And they'll go in and they can repair it and put a graft in there. If it's small enough, they can keep watching it. And so that's why it's so important to have that screening done. But again, I believe it's a 6 or 7% screening rate, certainly less than 10%.
So there's some takeaways you want folks to remember here as we near Father's Day.
Absolutely.
Maybe somebody needs to gently remind Dad he should be doing these things.
Right, or nag them. One is have a primary care physician. Even if you don't go regularly, at least have a relationship with someone who you can connect with if something goes wrong. 2 is that if you do go to the doctor, fully disclose what's going on. As minor as you think it is, it could be important. And the third thing is know your family history, because your family history can really influence what screening procedures are right for you. And that's where a lot of people, men and women, fall short, is knowing what their parents and their grandparents had. That can really make a difference in terms of what you get screened for.
Makes
Wonderful
sense.
tips.
Great.
Good to see you, Doctor.
Thank you, Dr. Giorgio. If you feel like you have health issues, of course, consult with your doctor or another medical professional.
Dr. Giorgio is the author of Healthcare Choices, 5 Steps, Getting the Medical Care That You Want and Need. It's available online. You can purchase a copy on her website. We'll post a link for you on MinnesotaLive.com.